Hello, my name is Dr. Lucia Cagnes. I'm a board-certified OBGYN practicing in Cagnes, Cape Cod, Massachusetts. Welcome to my video number 4 in the series of videos about HPV infection. We're going to talk today about HPV in men. Is HPV virus infection only a woman concern? Statistic shows that 23.4 million of men just in the United States are diagnosed with HPV infection. There are no screening tests for HPV in men. HPV is only diagnosed once the patient has developed the disease with a biopsy from the tissue affected. Most common cancers in men are caused by the subtype of high-risk HPV number 16. The most common place for the cancer to develop is head and neck. Majority of the cases are located at the base of the tongue and in the tonsils. Penile cancer is very rare, accounting for only less than 1% of all the cancers in men induced by HPV. Some data also indicate that HPV-16 could be involved in prostate cancer. In fact, a meta-analysis published in 2017 showed that 16 to 53% of prostate cancer tested positive for HPV-16. HPV-16 can also cause infertility in men or contribute to infertility by either decreasing the motility of the sperm or inducing the development of autoantibody against the sperm. 10 to 35% of men who are infertile tested positive for HPV. The risk factors for men to develop the disease, which is mainly transmitted by skin-to-skin contact, sexual intercourse, oral sex, anal sex, is young age, multiple partner, alcohol and smoking increase the risk of developing serious complications from HPV. Because the immune system is the first line of defense against the virus, patients who have a weakened immune system or are taking immunosuppressant medication because they've been diagnosed with health conditions such as psoriasis, Crohn's disease, ulcerative colitis, they are at very high risk of developing serious consequences with HPV infection. Because there are no screening tests available for men at this time, it's imperative to detect any possible cancer or precancerous lesion very early. Men should go for their annual exam, make sure that especially if their partner tested positive for HPV, they are screened very frequently. And one of the most important screening is in the oropharyngeal area. So the dentist will be extremely important provider in diagnosing any early lesion with HPV. The only preventive measure is by vaccinating young men aged 11 to 12 prior to initiating sexual activity. But some studies indicate that getting vaccinated even later in life even in a patient who already tested positive for HPV, might have the effect of boosting the immune system, promoting the clearance of the virus from the body. Please let me know if you have any question about this important topic. You can find me at www.yourhpvmdcoach.com. Thank you for listening, and I will talk to you soon.